After 50, hip pain can feel like a mystery, especially when the usual answers don't apply. You might be told it's arthritis or that surgery is the only path forward, even if the pain doesn't quite match. So, if you're stuck between vague advice and real pain, this hip series might help you ask better questions and feel less alone while you figure it out. Let's get right into the first move we're testing because that's why we're here. So, before we start, just a quick reminder, I'm a functional strength coach. I'm not diagnosing or treating any medical conditions here. What I'm sharing are real conversations I've had with clients like Autumn and Nancy and the low intensity movements we've tried together to explore some possible options for pain relief. I'm not recommending anything directly to you, and everything in this video should be run by your medical provider. That said, part of the challenge and why I'm even making this series is that it's been hard to find medical professionals who look at these kinds of symptoms in depth. So, no, I'm not saying Dr. Google is better, but I am saying that sometimes when you're told this is just aging or you should be happy with what we've done, it can leave you feeling stuck. And if your body's still saying something's off, you deserve space to explore that. The first exercise in our hip pain series is nerve flossing. Before you build strength, your nerves need space to move, but how do you do that safely? A stretch might make the pain worse, like a zing or a pinch instead of relief. When nerves are irritated, they don't like to be yanked or held in one position. Who doesn't? That's why traditional static stretches can actually make things worse sometimes. What we're trying here is a gentle rhythmic motion, something that encourages the nerve to glide, not get caught. One option is called nerve flossing. It's a low load movement where you alternate between foot and head position, kind of like a gentle seesaw for your nervous system. The goal isn't to stretch hard, but to restore normal movement patterns. That's what we started with. We tried a prone nerve glide, lying on your stomach, gently alternating chin tucks with heel lifts. No forcing, just motion. And for some people, that's enough to start calming things down. This first move that we're testing is a low load nerve floss, and hopefully it's going to encourage the femoral nerve to glide. The femoral nerve is a nerve that's located in the front of your hip. That's one thing that we're definitely finding might be one aspect of what's causing nerve pain. Okay, so now let's zoom out a bit because for too many women, the pain they're feeling isn't just aging at all. For example, Autumn had already recovered from one knee replacement. So why did the second leave her with a brand new pain that no one seemed to expect? She had done everything right. She followed the rehab protocol. Her joint looked great on paper, but this time something felt off. She'd been sitting on the couch, then would stand up to grab something, and bam, that lightning bolt of pain down her inner thigh. And every time she thought, this isn't the knees, what is it? So, what we're finding out is that possibly post surgical pain doesn't always follow the script it's supposed to. Sometimes it's not the joint itself, it's a nearby tendon, possibly, or a nerve or a bursa that gets irritated in the process. And if no one's looking for those kinds of complications, you're left second guessing your own recovery. Same with Nancy. She hasn't had surgery yet on her hips, but the front crease of her hip, it just shuts down when she tries to stand. We are thinking that maybe the femoral nerve is involved, but again, I'm not a medical professional. But when the nerve is irritated, the muscles just don't seem to be firing properly, and it's not all just weakness. It's like a signal isn't getting through, and if you're not looking for that, you're not going to find it because nothing shows up so far on a scan. X-rays are great for showing the structure of your bones, but they don't show muscle coordination. They don't show nerve irritation. That's why you can have a perfectly placed joint replacement and still feel unsure on stairs, walking after you just get up out of a chair, and you're still wondering why your legs feel off. Joint replacements fix the hardware, the joints themselves, but they don't rebuild muscle and nerve patterns. Sometimes those things may get irritated, and we just need to get strong again. So let's move on to exercise 2. It's a side lying hip opener. Okay, so once the nerve is gliding better, How do we make space in the joint without triggering more pain? That's the tightrope that we're walking here. So we're going to try a hip flexor stretch. And if you feel a sudden jolt of pain or too much or too fast, you're going to have to make sure that you're being very careful with this type of thing. The hip flexors are tricky. They're usually tight from sitting, but they're also weak. So when you try to stretch them the old fashioned way, kneeling, lunging, pushing, it can pull on already irritated tissues. We want to create openness, but we also want stability. That's why we shifted to side-lying openers. These allow you to control the movement more carefully. You're supported by the ground. You can ease into the range instead of forcing it. And that combination, stability plus space, it's what helps calm the front of the joint. Now, these are great for anybody. Like if you sit a lot, especially, think of it that way. If you feel like you have tight hips, these are things that can help open up those hips so that you're not going to be suffering from any type of impingement or inflammation. Okay. So this one variation, lie on your side with your knees bent, reach your top arm and leg backwards slightly and pause just enough to feel a release. Not an aggressive stretch, but just feeling like you're opening up that hip. Okay. These side-lying hip openers can release tension in the front of the joint without triggering inflammation. Now, the next exercise is a little more aggressive. So again, if you do have any real knee pain, hip pain, any real issues, again, you need to be cleared by a medical professional before you try any of this. Because again, like I'm saying, Dr. Google should never be your primary healthcare professional. Okay, this exercise is a knee lift. Strengthening the hip is essential. But how do you load the joint without tipping it into irritation? Okay, you try lifting your leg with a band or an ankle weight. Here's the balance with this exercise. We need activation, not aggravation. That means the movement has to be short, controlled, and repeatable. You're not chasing, fatiguing the muscle. You're just rebuilding the connection, building some strength back. So even a few reps can be powerful if they're done with focus. So we start with a basic knee lift, no weight, just laying down. You can do this on your bed. You can do this on a couch. You can just put your legs up on some pillows. So when you're ready, you just lift the knee, pause, and then lower it. That's it. If that feels good, you can add a small band or a light ankle weight, but the key is control. You want to make sure that you're building strength back, okay? So really focus on just a gradual intensity. So Nancy started with 5 reps per side, holding each for a count of 3. This was enough to fire the muscles without flaring the nerve. So even a simple knee lift can restore strength, as long as it's controlled with just a short duration and matched to your current ability. That's essential. Okay, so here's what I want you to hear loud and clear. Just because your surgeon cleared you or your doctor prescribed a med doesn't mean your recovery is done. Go talk to your physical therapist, go talk to a medical professional. I'm just saying this as a strength coach, all right? It's just my opinion. And again, I'm not Dr. Google. I'm just a strength coach here, okay? So if you're still in pain, if you still feel unstable, weak, or unsure, that deserves attention. Okay, don't just accept I'm older, I have pain, they did the best they could. Maybe they could do more. It's a matter of just finding the right resource, okay? So that means more than just a pat on the back and them moving you along the way and saying, well, you're older, that's the best we could do, all right? A lot of standard care focuses on healing the joint, not restoring your strength. But strength is the thing that gives you your life back. It's the difference between I'm managing and I'm back in the game. I'm ready to do whatever's next. Grand shoulder and hiking, still working, and you deserve that. So again, approach these exercises with caution. I'm really just at this moment, this hip series is just journaling what my clients are doing. And I will report back with how they're doing. My client Nancy is preparing for hip replacement surgery. So we'll be reporting back to you. And again, don't just take these exercises and run with them. Go to your healthcare professional, see if this is the right approach that you need for what you're experiencing. Okay. We're seeing the possibility of the femoral nerve being impinged in the front of the hip. We're seeing possibly a bursa being irritated in the inner thigh. And along with that, it could be a combination of those things and some tendinitis, some type of tendinopathy. But again, that can only be uh, confirmed by a medical diagnosis. I'm not saying that's actually what's happening here, okay? Just want to be very cautious with this. It's just been difficult to find healthcare professionals that will talk about these things to their patients so far. So hopefully, I'm not creating more controversy. That's not my goal here. If you feel like you're ready to do just some basic exercise, you might have a little bit of inflammation that you're recovering from. I do have a very gentle mini workout. It's about 5 minutes long. And along with that, because this type of pain can be so frustrating, I have a chart of mindset strategies that my clients use all the time. So if you uh, want to start with not even lifting a weight or breaking a sweat, take a look at the chart first. From there, try the mini workout if you're medically cleared. And then you can just go from there and see what you can do. Go ahead and comment down below and share what your issues are as far as your journey, your joint pain, and why it may be becoming a chronic issue, because maybe for some reason you're not getting enough information. All right. So go ahead and download the chart and the mini workout and take a look at this video. It just shows you some of the general exercises that we do at my fitness studio.